I'm going to be kind of continuing what I've been doing the last little while. And so I've been talking about uh, economic situations and how economies are going to affect people globally, people in poverty globally, seniors in poverty globally, more specifically in Canada, even more specifically in the province of Alberta. All of this can be related to global phenomena and global issues. Um, Today I'd like to expand it but shrink it at the same time. So I'm going to shrink down to Edmonton, Alberta, where I live. And I'm going to expand the ages that I'm looking at for housing, and then I'm going to shrink it to the population with disabilities. And when I talk about disabilities, I mean psychiatric, cognitive, physical health, and sensory. Many people cross, not, they don't just fit in one subtype, they cross. Some people have, like for instance, I have multiple sensory issues. So you can't just assume because you hear the word disability that means we need a ramp. That's a very simplistic view of housing accommodation for persons with disabilities. There are many accommodations that may be needed, and for any individual, they may need many accommodations in a variety of ways. Um, it The reason I'm focusing on Edmonton is because, frankly, I live here, and it allows me to kind of hone in on a specific target, if you will. But like I said, these issues apply globally. I think there was just a little something that happened with my camera, but I'll figure that out. Housing instability disproportionately affects persons with disabilities, and that is true whether the disability is related to a mental health condition, a developmental issue, physical issues, chronic health, or sensory limitation. Um, Folks require specific accommodations that are not universally available. So, first of all, we need to note that Edmonton's housing market reflects broader national situations like rising costs, an aging housing stock, a growing need for affordable and accessible homes. So, while governments at the municipal, provincial, and federal levels have implemented some initiatives uh, to address housing issues, the progress is slow and fragmented, and this is particularly true in the current political environment. Um, Political priorities, constrained budgets, and a focus on austerity measures frequently limit meaningful reforms. For individuals with disabilities, these systemic challenges are compounded by intersecting issues such as stigma, discrimination, and the inadequacy of support services. So, what is the current housing landscape in Edmonton? Um, for persons with disabilities. Well, first of all, there's market housing. That simply refers to rental or own properties without available subsidies. Uh, Market housing constitutes the vast majority of Edmonton's housing stock. It is often inaccessible for individuals with disabilities, and by inaccessible, I don't just mean physically accessible, I mean for sight and hearing, I mean for persons dealing with chronic illness who need specific kinds of air filters or other assorted things, for individuals with psychiatric disorders who need a level of support that may not be available. First of all, it's important to note that there are rising rental costs, limited availability of accessible units, and discriminatory practices from landlords that do create significant barriers. And I think anybody who has got a visible disability, when I pull up my cane, people know, And it does lead, in fact, to quite significant blatant discrimination, which is not being dealt with by our government. Now, according to the Canadian Mortgage and Housing Corporation, and they give what I would believe is an underestimate of the average rent of a one-bedroom apartment in 2024 in Edmonton. They talk about it being $1,200 or more. They're significantly more than that, unless you kind of include things that aren't really one-bedroom apartments that are being listed that way. Now, it's important to note that this is even at $1,200, it is completely unaffordable for many individuals relying on fixed incomes, such as like assured income for the severely handicapped. There is subsidized housing, and these programs aim to reduce housing costs for low-income individuals, including persons with disabilities. Programs such as the Rent Supplement Program managed by the Government of Alberta and local initiatives like Capital Region Housing provide rental subsidies or affordable housing options. However, and this is the biggie, the demand far outstrips the supply. The waiting lists are years long. There's also supportive housing, and this is the kind of housing where housing is integrated with services such as case management, counseling, daily living assistance. So in Edmonton, organizations like the CMHA, Canadian Mental Health Association, and Excel Society offer supportive housing for individuals with mental health or cognitive disabilities. However, again, demand far outstrips accessibility. There simply isn't enough available to meet the need. There are also group homes and assisted living, and these cater more to individuals who require higher levels of support, including 24/7 supervision or assistance with activities of daily living. These settings are particularly relevant for individuals with developmental or cognitive issues. So, for example, in Edmonton, organizations like Winifred Stewart Association provide such services. However, with what limited availability again, but also it's important to note that these may not align with individuals' preferences for independence and community integration. It keeps you kind of dependent. Now, there are emergency shelters and transitional housing, and individuals with disabilities in a housing crisis may depend on these, but some of these shelters, most of them actually, are ill-equipped to support persons with disabilities. And again, this crosses the border this crosses all areas of disability, so they may not be accessible. They may not provide support for persons who need more assistance. They may not provide emotional support to a level that someone with a significant psychiatric disorder needs. They may not understand the cognitive needs of someone with a developmental issue. The list goes on. The Alberta Affordable Housing Partnership and federal provincial agreements under the National Housing Strategy exist. However, it's important to note that cuts to social programs and austerity measures in recent years have limited the impact of these initiatives. At the municipal level, Edmonton has adopted strategies like A Place to Call Home, which emphasizes ending homelessness, but again, funding shortfalls remain a huge obstacle. What are some of the specific housing challenges for adults with disabilities? Well, obviously affordability. It's a primary concern for many people who rely on programs like AISH, where the maximum a month is just over $1,800. So, for example, if an apartment costs $2,100, because it's accessible and you're lucky to even find it, you can't afford it. There are also those accessibility issues. The housing stock is predominantly designed for able-bodied individuals, so leaving individuals with physical or sensory disabilities at a disadvantage. Wheelchair accessible units are in extremely short supply, and older buildings often lack things like elevators and wide doorways. Uh, Similarly, housing designed for individuals with sensory disabilities, such as vision or hearing impairments, just basically doesn't exist. There is the issue of discrimination and stigma. Adults with disabilities often face discrimination in the housing market. This is not new. Um, Landlords may be hesitant to rent to individuals' mental health conditions or physical disabilities due to misconceptions about the individual's ability to maintain a property and even pay rent. And although such discrimination is illegal under the Alberta Human Rights Act, in reinforcement of this, it it remains inconsistent and it's not even worthy of a mention. There are systemic barriers in accessing housing programs. So, for example, navigating programs and support services can be overwhelming for an individual. Eligibility requirements can be complex. The application processes are time consuming and they are poorly coordinated between agencies. For example, individuals may need to provide extensive documentation to qualify for subsidized housing, which can be a huge barrier for cognitive disabilities, people with limited access to administrative support or like printers, that sort of thing. It can be very complicated if you fit multiple disability groups and you're trying to meet all that information overload as well as find something that fits that they will allow you to enter into. There's also a lack of emergency housing options. Um, so there's a very, very small percentage of emergency shelters that are accessible, and many are simply not equipped to accommodate wheelchairs or specialized care or individuals' complex medical or mental health needs. So let's look at more specifics. What about individuals with psychiatric issues? Well, first of all, there are challenges for them with housing stability. They experience evictions and housing loss, and this is common among this group. They are often triggered by symptoms such as difficulty maintaining employment or behavioral issues, which results in these behavioral issues such as acting out in a housing environment, which results in them being evicted. Without adequate support, they may cycle through homelessness, shelters, and hospitalizations, and that is no way to live. They require supportive housing needs or may require supportive housing needs. And so we have programs like the CMHA Edmonton Supported Independent Living Services. This can provide a lifeline, but again, funding constraints limit their capacity. They experience stigma and discrimination. So the stigma about mental health remains pervasive and it influences landlords' willingness to rent to individuals with a psychiatric condition. This discrimination very rarely is addressed and it marginalizes individuals' mental illness even further. Individuals with cognitive and developmental disabilities such as trisomy 21 or autism may need housing required to meet both independence and support at the same time, that kind of combination of needs. Now, there are transition challenges. So as individuals transition from childhood services to adult services, they may encounter gaps in housing support. Families may struggle to find appropriate housing, leading to delays in achieving independence. There is the importance of community integration. So for individuals with cognitive or intellectual disabilities, it's important that living in community-based settings versus institutions because it fosters a sense of self, it increases social inclusion, and it helps people to do as well as they can versus being limited by an institutional setting. So programs like inclusive housing cooperatives or group homes with community engagement are important and essential, but they are underfunded, as I'm going to say so much. Then there are issues like physical health or sensory disabilities. So, for instance, physical accessibility barriers. The lack of accessible housing is significant in Edmonton and has not changed very much in many years. Many rental units do not meet even basic accessibility standards, such as like step-free entryways or accessible bathrooms. Retrofitting older properties is expensive, and few landlords are willing to take this. For people with sensory disabilities, units that have visual or tactile cues, for individuals with blindness, or amplified doorbells for those with hearing issues, it just basically is almost non-existent in Edmonton. There are solutions. There are things we can do. It takes a government that is motivated to help. That's kind of an issue right now, but let's talk about them. First of all, we need to increase affordable and accessible housing. And that means that if the government would prioritize the construction of affordable, accessible housing units through incentives such as tax breaks for developers, this could help increase the gap in housing. We need to enhance funding for disability-focused housing initiatives. So initiatives like the CMHA's program. Federal and provincial governments, really, it would be great if they would allocate more resources to expand capacity and reduce the size of wait lists. We need to simplify access to these programs. So streamlining eligibility criteria, application processes that are designed to reduce administrative barriers. A centralized system for housing applications could improve coordination between agencies. We need to combat stigma, and this happens through education. So, public awareness campaigns that target landlords and the general public can help reduce stigma and discrimination against individuals with disabilities who are seeking housing. There needs to be a strengthening of collaboration between sectors. That means governments, nonprofits, private developers, and they all need to come together to address these gaps in Edmonton's housing landscape. We need to strengthen collaboration between these sectors, as I said, but it's not just about them coming together. It's about these organizations using each other's strengths. So nonprofits may have more expertise in disability service, and they can act as intermediaries between government and developers to ensure that the housing they're building meets the needs of persons with disabilities. We need to expand the Housing First approach for disability inclusive services. So programs based on the Housing First model, such as those implemented by Homeward Trust Edmonton, provide immediate access to housing without preconditions, pair these with individualized support services. By expanding this approach with a specific focus on individuals with disabilities, we can prevent unnecessary barriers to stable housing. We need to invest in retrofitting existing housing stock. And it's important to note that much of Edmonton's housing stock was actually designed and built prior to accessibility standards being invoked. So it's important that governments do things like offer grants or subsidies to landlords and property owners to make necessary modifications, such as installing ramps, elevators, accessible bathrooms. We need to increase support for independent living programs. So, for adults with cognitive and developmental disabilities, independent living programs are a critical bridge to autonomy. And funding for these organizations that provide the skills training, home management support, and case management should be prioritized to help individuals transition successfully into community based housing. Now, here's a kind of a funny, offbeat story about that. It's not that funny, but it's kind of funny. Many, many decades ago, when I was still in Ontario, I was working for an agency that sent out support to help persons with cognitive issues live in the home. And I met with this mother who couldn't understand why I had to be paid. Don't you people do this out of the goodness of your heart? And I had to keep from laughing. Yes, people do this out of the goodness of the heart. Hopefully, you're getting people who care about other people. But that being said, they still have to build a roof over their head. So housing isn't just one way. Even the people who are working in this field do need to be able to live in a safe home. And it was a very strange conversation, but a memorable one. But this brings up the issue that yes, we do need to think about the people we're hiring into these programs. They need the proper training. They need a decent salary. They need all of the basic essentials that we consider for most workers in our society. What about developing specialized housing for sensory disabilities? Well, this is frequently overlooked, and so for housing supports, for municipalities, for developers to work with groups such as the CNIB, Canadian National Institute, or the Canadian Hearing Society, CHS, is very important. We need to advocate for policy reform. So funding groups that are trying to get funding increased must focus on programs like AISH. AISH, they've really reduced what they're calling tied to the rate of inflation. So, for instance, if the rate of inflation is below 2%, and I don't know where they get that from, there will be no increase. If it's above, there will be half the inflationary rate increase. So rents go up, everything else goes up, food, utilities, everything, and people can afford less and less, which puts them more and more in danger of homelessness. We need to address the emergency housing gap. Shelters and so forth, they need to be increasingly made accessible. And this is something that should be prioritized because, as I said, more and more people simply can't afford to survive and they're homeless and now they can't access the shelters. We believe in Edmonton that people have a fundamental right to safe housing. Do we always show that we can actually accomplish that? No. There is a significant challenge in this area. There are huge barriers, and that includes affordability, accessibility, systemic complexity, and social stigma. The housing doesn't exist, and the ability to access it doesn't exist. So we know that both political and economic constraints have limited the progress in this area, but targeted interventions will or could change that. It means increasing the supply of affordable, accessible housing, expanding funding for disability-focused initiatives in housing, and enhancing public awareness. These are all key steps, but we are, I guess, not there with the current government. The fact is that ultimately a society is judged by how it treats its most vulnerable members. And Edmonton can increase and build on the way it's judged in a more positive way if we start to think about our vulnerable citizens, such as those with disabilities, and how we can support housing for them. To address the systemic gaps, we need to address the issue of income, prioritize it. So it requires a collective effort, but it is one that is worth doing. If you enjoyed this video, I hope you, as I said before, will hit subscribe, like, share, and explore. And please remember that to be senior is to be proud. Hugs.